Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com is Croup Contagious for children and adults. Croup is a contagious upper respiratory tract infection that can cause airway swelling and a hoarse, barking-like cough. Croup is most common in children aged between 3 months and 5 years. However, anyone can become infected. /r/n/r/n Croup leads to swelling around the vocal cords and windpipe. Typically, children recover from croup on their own in 3 days to a week. /r/n/r/design, Getty Imagesrnrn Croup is contagious for the first 3 days after symptoms startor until the infected person has been fever-free for 24 hours. While the person is contagious, they can easily infect others. /r/n/r/n Though not everyone who gets infected will develop croup, it's still a common illness among children between 6 months and 3 years old. Avoid taking your child to school or daycare if they may spread croup to others. /r/n/r/n In general, after 3 days or an absence of fever, normal activities can be resumed. However, every child is different. Monitor symptoms and consult with your pediatrician or primary care provider when unsure. Some symptoms, like coughing, can persist, making it more challenging to return to all normal activities. /r/n/r/n While most children develop a fever with croup, some children never do. Younger children experience a fever at lower temperatures than adults. Fever is considered to be a temperature as follows: :r/n/r/n A parainfluenza virus causes the majority of croup cases, typically in the fall and early winter. /r/n/r/n Most children get croup from breathing in respiratory droplets spread by sneezing, coughing, wheezing, or crying. /r/n/r/n Importantly, having a croup infection in your household once doesn't necessarily mean it won't happen again. Children can get croup more than once. /r/n/r/n Croup can be passed among children and from a child to an adult. However, adults are much less likely to develop symptoms because they have larger airway swelling doesn't affect them as much. /r/n/r/n Adults often get croup from being in close contact with children who are contagious with the croup infection. In rare cases, croup is linked to allergies, bacteria, or acid reflux from the stomach. /r/n/r/n Symptoms of croup include /r/n/r/n Croup typically gets worse before it improves. The illness begins with cold-like symptoms and progresses to the barking cough characteristic of croup and breathing difficulties. /r/n/r/n It is important to look out for stridor, a high-pitched breathing sound caused by abnormal airflowits, a sign the croup is getting worse. Experts say symptoms can worsen during nighttime and when a child is upset and crying. If stridor occurs when a child is at rest, that is, when not crying or coughing, it is a sign of an emergency. /r/n/r/n In the most serious cases, which are rare, experts say signs of croup worsening to emergency status include a pale or bluish color around the mouth due to a lack of oxygen. Less than 5% of children with croup require hospitalization. Even in these cases, hospitalization for croup is typically no more than a few hours to 2 days. /r/n/r/n Respiratory syncytial virus, RSV, refers to both a common respiratory illness and one of the viruses that can cause croup. Symptoms of the illness are typically mild and similar to those of the flu or COVID-19, including /r/n/r/n People with RSV are contagious for longer than those with croup, for 3 to 8 days in most cases and for up to 4 weeks if they're infants or have weakened immune systems. /r/n/r/n Whooping cough, also known as pertussis, leads to a distinctive whoop sound when a person inhales after a coughing fit. It starts with mild symptoms similar to RSV and progresses to severe coughing fits that usually last between 1 and 6 weeks. Whooping cough vaccines are available to help prevent the disease or make its course milder. /r/n/r/n complications with croup are uncommon. Experts recommend calling 911 or going directly to the nearest emergency room if the child with a croup infection experiences the following symptoms: /r/n/r/n to prevent the spread of croup. Children with symptoms should not go to school or daycare for the first 3 days after the onset of symptoms or until their fever resolves. /r/n/r/n Other methods of preventing the spread of croup to others include /r/n/r/n Croup is an infection typically seen in children between the ages of 3 months and 5 years. The virus can spread among children and between children and adults. However, older children and adults typically don't experience any symptoms. /r/n/r/n The croup infection is contagious until 3 days after symptoms start or, if fever is present, until the fever resolves. While a person with croup is contagious, the virus in mucus or respiratory droplets spreads through sneezing, coughing, crying, and wheezing. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.